Hi, it's David Rowe from Rowe Chiropractic offices, and I'm here with Ryan. And Ryan has graciously agreed to share his experience about what he's gone through with his chiropractic care and a specific topic, scoliosis. So thank you so much. I appreciate it. Yep, fantastic. Good. Hey, how did you come to find us at Rowe Chiropractic? Do you remember how you got introduced to the practice?
So at first I was told that I had scoliosis after an x-ray at the hospital. So we went to go look for various solutions, and one of them was going to a chiropractor in my local area. And I went to him for about, I would say like probably 2 months. And this was like for a little bit of time. And what happened was I hadn't really gotten as much improvement after I had gotten another x-ray. So
he said, I don't think it's going to improve anymore what we're doing. This thing might actually be slipping. Yeah, and so an amazing chiropractor giving you these great adjustments, but he's saying the scoliosis itself might not respond to just adjustments. That's, yeah.
Because going to him, I did feel better, but I didn't see an improvement. So he recommended me to Dr. Rowe, and I met him about a year and a half, like 3/4 ago. So I would say.
Yeah. So the chiropractor actually called me up and said, hey, Dr. Rowe, I know that you do some similar techniques that I do, but also that Rowe Chiropractic specializes in scoliosis. So he said, would you take a look at this guy? I really care a lot about him. We just send him over, Ryan, kind of send him over for an evaluation.
Yeah.
Great. So we took the x-rays when you first came in. We did a discovery exam. We took a new set of films, and we had looked at like the progress, and we're saying, oh, this is worsening. Now, how old were you when you first started with me? Do you remember?
I was about 15, probably like late 15, yeah.
Yeah. And the thing about the age is that if we're still spinally developing, if we're still growing, it's a situation where it can get worse, but it's also an opportunity to get it better. Now, you're at 15 for young men, they're still growing developmentally, so we figured, okay, there might be a little window of opportunity before you reach maximum, what we call skeletal maturity, where we can actually get some correction. So do you remember like what we did? Like how did we mix our techniques together to help you? What did we do?
So I remember that the doctor I first gone to, he had given me a ScoliRoll, and with that, Dr. Rowe introduced me to traction exercises and block exercises. So I started doing that, and I saw that it stopped getting worse. So it finally did stop moving, which was I think the first step. And then eventually we started doing other things, including a brace, which I'm now wearing now. And it started to actually improve the curve a little bit more. So
yeah, absolutely. So we did in this kind of approach, this technique we do with all patients, including the scoliosis, in terms of we give specific adjustments, we teach therapeutic exercises opposite of the pattern, and because of the pattern of the scoliosis is kind of dramatic, so that you have to do this dramatic exercise routine. And by the way, it's called ScoliBalance. I don't even know if I've ever said that to you. Then we're adjusting, doing therapeutic exercises, we're doing the ScoliRoll, and we were also doing in-office traction. And the in-office traction is because we know that in order to change the shape of the ligaments, we've got to hold it in a position over 10 minutes. So we do the in-office traction at 15 minutes, and you do your home traction at 20 minutes. So then we do the scans, and we order the ScoliBrace. Now, when you first saw the ScoliBrace, what did you think?
I was a little scared, I'll be honest, because it looked like a device. It didn't look great to me.
It didn't look great. Now, go ahead. I didn't mean to cut you off.
Yeah. So when I first got it, I was a little scared, but when I eventually put it on, it was tight at first.
It was tight,
and it was a little bit hard to get used to. But I would say after about a week or like I would say 2 weeks of wearing it, it started to feel kind of like a normal piece of clothing, or just a normal part of myself. So.
And do you think you changed the brace, or do you think the brace changed you?
I kind of think both in a way.
Let me tell you the truth, you're not changing that brace. That brace is exerting influence.
Yeah,
so the brace is changing you. And that's why you get used to it. Because your body starts to soften in the direction of correction. Yeah. And then by the way, we thought because we're always concerned when a patient first gets the brace, like how are they going to adapt to it? If we can get through that first week, first 2 weeks, people do better. The whole practice was like, Ryan's doing amazing. Because I come back and I say like, hey, how many hours a day are you wearing it? And you're like, at the beginning, do you remember how much you were wearing it?
I honestly don't remember. All I know is I was wearing it throughout the school day.
Yeah.
So that was a lot of time already.
Yeah. And were you sleeping in it?
Yeah, I was sleeping in it.
Yeah. So we're recommending that we try to get as close to 22 hours a day, and you were really doing that. You were wearing it all the time. You take it off the shower, take it off for soccer, and you were playing high school soccer at the time.
Yeah, I was still doing school sports, and right now I'm actually still going to the gym and everything. But I just take it off, work out, do my stretches, and then put it back on.
That's right. That's amazing. And we've always been impressed with your dedication to the process. Mm-hmm. It can't happen without the patient participating. So you've been doing great with that. And once you got used to it, and then you wore it for 3 months, and we took a comparative X-ray. Mm-hmm. So we had this first X-ray, we put the brace on, then we take an X-ray with the brace on to see what it's doing. Say, okay, that's actually making a change with it's on. 3 months later, we take an X-ray with the brace off to see if there's any changes. And do you remember what we saw?
I remember we saw actually a good improvement to it. It was actually starting to push back because at first it stopped and it started to actually it started to correct itself with the brace on.
That's right.
With it off,
Yeah. And the research tells us that the brace is a vital part. If you're going to try to really change the angle of the scoliosis, the brace is a vitally important component of it. Yeah, it did actually change. That was great. And at some point I said, hey, the brace is starting to get loose. We got to do a modification. You remember what that process was about? Yeah,
so what we had to do is we had to add a padding to the inside of the brace so that would actually correct more.
Yes.
And because we had made a good amount of progress, the brace was starting to become less like optimal.
Yeah, less corrective. Yeah, because you've already shifted. So because you've already shifted, it's almost like you're a different person. So that brace that we made initially wasn't going to be effective enough, so we put some pad in. I remember a funny thing happened that one of the pads popped out, but your dad went and got got adhesive and got it back in there, right? Yeah. We figured that part out now, how to keep that from happening. But so it's been like a family participation. Mm-hmm. And speaking of family, is there anybody in your family that's involved in spinal correction?
Well, one of my older brothers, he's a chiropractor too. He does the practice. So,
which is really awesome.
So he kind of gave me some advice on it, and
So that was helpful. Mm-hmm. Yeah, it's good to have, and I know that mom and dad have been so supportive of the process. They're driving you because you don't live around the corner from me. How far away do you live from the practice?
About an hour 30. So around like that time.
Yeah,
so it's a little bit of a drive.
Yes.
I'm willing to make the journey.
And you've been super consistent by doing the Scoli roll at home. So you're lying on the roll that's pushing the cage to the side. So your pattern is shifted left, side bend right. And then twisted this way. So you're lying on this on the left, pushing it over, creating that correction. Mm-hmm. Fantastic. And you've been doing your therapeutic exercises, getting adjusted. Now, so how was it just like emotionally, if I could say it like that, like just getting used to the brace? How tough was that?
It was hard at first, especially going in the public with it on. I kind of felt a little out of place sometimes, but I think over time I kind of just started getting accustomed to it. It's kind of funny how the brain stops like thinking about certain things, and it kind of got to a point where I would forget that I had it on for like after a few hours, and then eventually kind of just became a part of my life. So I accepted it, and over time it's now just my brace. So
yeah, cool. And your friends, did you think like initially like your friends would have like a weird reaction to it, or how did you think about that, and how did your friends react to it?
At first they were a little confused because they hadn't heard about that. I had actually heard about some of my friends who had scoliosis in the past, but they had actually chosen to do the surgery, and they were like, oh really, you could do that? So I was a little I was like, yeah, you can. It said it may take a little longer, but Rome wasn't built in a day, and I like this exercise, so I think it's a good addition. So most over time, people actually got used to it, and eventually people even stopped talking about it because honestly, it just became a part of everything. So.
Yeah. So was there, even though it's a bit of a nuisance, was there anything that you wanted to do that you couldn't do because of the brace?
Not really. It was just a few extra minutes. I would have to take it off, put it in its bag, and then go do something else. But the only problem I would say is my body had to get used to me having it off now because I've been wearing it so much. So
Yeah. The ScoliBrace, the great thing about this technology is that it strengthens muscles, doesn't weaken muscles, so as we wean off of it. So now we're at a point where in a short period of time, you're gonna come back in, we're gonna take yet another x-ray to see if it's still correcting, and then we'll make a sense, because now you're a bigger guy.
Yeah.
And I'm gonna either have to redo the brace, I won't be able to modify it anymore because you're kind of outgrowing it, if you will. So then we'll either make a decision on either does it make sense to do a new brace, or do we just use the brace that we've got and slowly wean off of it, and you just continue with the therapeutic exercises. So that's it. Man, I appreciate it. Anything else you want to just say about, any encouragement? Because I think you've done great with it, and we really appreciate your participation.
Yeah, anybody who's a little scared to try the exercises and everything, it just takes a little bit of dedication, a little bit of time. But if you actually put a little, like at least 30 minutes aside every day to start doing your exercises, or even put a little bit aside to try and get the brace, it'll have actually a good impact. So it's pretty helpful.
Thank you so much, brother. I really appreciate it. Good. Super.